Hello, my name is Chiodini. I've had the great fortune of working with the folks in Pinellas County on the Diabetes Coalition and the folks at the St. Anthony's Hospital, Baycare Hospital, to try to actually prevent or lower the incidence of diabetes in Pinellas County by 20% by the year 2020. What I want to talk to you guys about today is actually the sustainability of diabetes prevention programs and even diabetes self-management education programs. I've had the great fortune of working for 20 years for the Tampa Metropolitan Area YMCA, so I was responsible for bringing the diabetes prevention program in-house at the YMCA and working with the CDC on an evidence-based program, the diabetes prevention program, and also part of the CDC's program and the CMS program in checking the funding and the outcomes of if the program is offered to people of Medicare eligible ages, so 65 and over, what would the outcomes be? And we found over a several year study that the outcomes were phenomenal. Actually, in the year 2018, the diabetes prevention program will be a covered benefit of Medicare participants. So that's significant, extremely significant. And we also know that about 86 million Americans right now are actually qualify as having prediabetes or having the diagnosis of prediabetes. We also know that these people, if they do absolutely nothing within the next 3 to 5 years, will actually develop diabetes. 15 to 30% of them will develop diabetes within the next 5 years. So you think about what's going on right now with the prevalence of the disease in the community and what it's going to become. We have to do something about it. And we have to do something about it because we also know that about 95% of type 2 diabetes is preventable. So as we start to look at how can we bring this program, this evidence-based diabetes prevention program forward into our communities, teach our providers about it, and bring the program into our community, how can it be sustained? We've got enough research right now through the YMCA of the USA's relationship with the Center for Medicare and Medicaid that we know that that program will change lives, that it will reduce the incidence and prevalence of diabetes. So we know that that it can work. What we really need to know now is how do we get people into the program, and then how do we sustain the program. So there's a couple of easy cases. When you think about the community-based organizations that deliver the program, you think about the YMCA, you think about the Department of Health, which are actually both delivering the program in the Tampa Bay area. The YMCA of the USA has decided that the program should cost $429 for the entire year-long program. At YMCAs around the country, this $429 also covers a YMCA membership for the entire family for the first 4 months, or the first 16 weeks of the program, which is the point in time where families are actually, or individuals or families, are going through the program and meeting on a once-a-week basis. Once they finish their 16 weeks, then they go into a monthly, bi-monthly, and then monthly actual sustaining programs as they finish their year out. So what we find is if people can get through the first 4 weeks of the program, there's a great chance that they'll actually finish the program. And what the Medicare study showed us that on average, people in the program actually lose very close to 5% of their body weight, which definitely changes what happens in their outcomes with actually having to live with diabetes. Also, there was a study done, a great study done, that they looked at the costs of developing diabetes. And insurance companies, and Florida Blue was one of the participants in this study, actually determined that a person living without diabetes costs about $1,200 per year. And once they are actually living with diabetes, the costs of their medical care over that year increases to close to $6,000 per year. So when you think about the community-based organizations offering the programs, that's one arm. Can our community-based programs, can they sustain it? Can people pay for it? Is there a way that self-pay can be part of that program? Is there also potentially a sliding scale for these community-based programs so that if you can't afford the entire cost of the program, can you pay based on your income? That's one way of doing it. We also want to look at corporate responsibility. If a corporation is covering lives within their company and their insurance is actually going up based on the health of that company, then perhaps they can look at this as a tremendous investment, because the investment over time is certainly going to pay off, not only in the costs of medical care, but also in their productivity. Persons living with diabetes actually miss more work than persons not living with diabetes, and certainly they're less productive. We also want to look at what third parties can do, third-party payers. Those are our insurance companies. Medicare's already in. 2018, it's a covered benefit. We've looked at Florida Blue over the year. They've actually brought that on. It's been part of their covered benefits for their subscribers in most of their plans for a couple of years now. We also look at United Health Care, which is part of the United Health Group, that actually were some of the first to actually cover it as a covered benefit for all of their lives that they cover. So how do we increase this? How do we make sure that everybody can get coverage if they have some sort of health care, which we know through Obamacare and through all the coverage that's going on in this country, the increase in number of people who currently have insurance, how do we make sure that all of those plans actually cover diabetes prevention? It's been shown to be a significant barrier. Being able to afford it financially is a significant barrier. How do we change and reduce that barrier? So we look at three different ways. We look at making sure it's covered by the insurance company, by the providers, whether it be Medicare, whether it be Medicaid, so again, federally funded programs, or whether we look at it from the private payers, making sure that it is a covered benefit for all those lives. That's a critical piece of it. We also want to look at it from the corporate perspective, making sure that the companies bring it on as part of the covered benefit for the employees. Coaches, YMCA coaches, Department of Health coaches, independent coaches can go into the company and offer the program. It's 1 hour per week for the first 16 weeks, and then after that it's only a couple of times a month that people meet. And they build that group camaraderie, and it's successful. We know that it's successful. So we look at those two aspects, and then we also look at the community-based organizations. If I don't want to go while I'm at work, if I'm not covered by Medicare or Medicaid, but I truly want to reduce my own risk and I discover that I am at risk, what can I do about it? Well, right now people can go hire a personal trainer. They can do it one-on-one. Why not have the same option available for persons who just want to pay on their own to make sure they reduce their risk? So part of our burden as providers in the community, caregivers in the community, coaches in the community, whatever role we're playing is to get the word out, to let people know that once you qualify for this, and it's a very simple 9-question quiz and then also potentially even a blood test after that to learn your fasting glucose value or your A1C value. Once you qualify for the program, how do you make sure that you then reduce your risk of it significantly? And if it's just going out and hiring your own coach or finding a YMCA that offers it, which most in the state of Florida the state of Florida is almost all covered by YMCAs now offering the program, or to the Department of Health. How do you get in with a group? How do you make sure that that's happening? We also want to make sure that those folks who don't have access to YMCAs or Department of Health, or even the knowledge of understanding that they're at risk, how do we make sure that those folks recognize they're at risk? And then how do we, probably the toughest burden that we have right now is getting our providers, our caregivers, whether they be physicians or physician extenders, how do we get this and make this prevention aspect a priority for them and not a secondary thought and not something that just happens because we recognize that providers are extremely busy. But how do we make sure that there's an educator within that group that can get these people to the places where they need to be, where they need to get to a class, qualify for a class, get to a class, figure out how to pay for the class, and make sure they become part of it. And we know that those can be available in a community. So in summary, we know that there's about 86 million Americans out there that are qualified right now as being pre-diabetic, or they're within the next 5 years, if they don't change their lifestyle, a significant number of them will convert to having to live with diabetes. How do we make sure that that doesn't happen? How do we change what's going on? So think of it as a three-pronged approach. Identify those people, get them to the quiz, do health screenings in your community, alert your physicians to the programs that are available, and then what is available to help these folks pay for their programs. We've got community-based programs. The YMCA will work with anybody. Financial burden should never be a barrier in a YMCA. The Department of Health often offers classes for free, getting people aware of these classes, finding the resources in your community and getting them to them. Also, working with our workplace wellness folks. again, looking at it from the productivity standpoint and the cost standpoint, from a business perspective, it's crazy not to offer a prevention program that is evidence-based, that is proven successful, that the federal government has said, yes, we're going to pay for it because it is that successful. That's the second way. The third way, again, is to work on our third-party payers, our insurance companies, to make this a covered benefit for every covered life that they have, and making sure that as the physicians write the prescriptions, that the people that can go to any place that they choose to go, to make sure that that becomes a covered benefit, and that sustainability comes from the insurance companies, the providers making sure people get into place, and then the community operating together to make sure that nobody is ever turned away based on financial need. It's doable, but we have to work together, and we all have to play our own parts and in our own roles in this. Thank you.